And welcome once again to our weekly media briefing and public health update with Montgomery County Executive Mark Elrich. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today is Health Officer Dr. Kisha Davis, as well as Dr. James Bridgers, Chief of Public Health Services, and Mr. Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Members of the media, remember to use the chat when we open this presentation for the Q&A portion of it. And with that, good morning to you, Mr. County Executive. Thank you.
Good morning, and thank you all for joining us today. First, I want to acknowledge that this is Black History Month, and we want to encourage everyone to learn, discuss, and contemplate the accomplishments and contributions of Black Americans to the history of the county, the state, and the nation. Understanding Black history is critical to understanding the residual and long-lasting impacts of systemic racism, discrimination, redlining, and years of oppression. And it's important to recognize that this isn't something that happened, 160 years ago and then went away. The struggle for equality is actually a struggle that continues today, whether it's hiring practices or loaning practices or admissions to schools. The results or the effects of slavery and American history post-slavery continue to affect people's economic and social well-being in American society, and we have to come to terms with that. We're one of the major countries that had slavery and has just never been able to even have a discussion about reconciliation. And we've got to get beyond the point where people are so uncomfortable and worried to talk about it that we can't have necessary conversations. There are too many people in this country who think that with the end of slavery, that was the end of oppression and then everything was fine, or after the Civil Rights Acts of the 60s, that everything was just fine. And it's just not true. And, if we can't talk about it, we're never going to be able to deal with it. So in my mind, this is really critically important for how we move forward and how we build a stronger country and how we help improve the economic fate for so many in our community. It's not going to happen if we're not willing to talk about it. I remind myself of the fact that, if we look at every single social indicator, the African-American community is at the lower end of the social indicators, whether it's educational attainment or income or home ownership or access to healthcare. These most fundamental things continue to play out in a disfavorable way toward the Black community. And we have an obligation and responsibility to deal with it. And this month, we'll be talking a lot about Black history, and it's important. There are going to be a lot of lectures and events scheduled across Montgomery County to mark Black History Month. Almost every one of them is going to focus on the painful history of the ancestors, as well as what continues into present day. We're grateful to the families that have shared their stories of oppression so that we can understand our true history. I want to mention there's an exhibit at the Wheaton Library this month detailing the tragedy of 3 men who were actually lynched here in Montgomery County. The exhibit's on display through the end of February to remember the victims and promote reconciliation and healing. And it's more important than ever we continue to teach about Black history in our classrooms as well as our homes. Just last year, Virginia Governor Glenn Youngkin proposed changes to the state's history curriculum that erases mentions of slavery, institutional racism, and prominent figures of color. You don't get more racist than that. This is an outrageous disservice to the students and a warning that we have to be willing to promote and teach history and the effects of what systemic racism is, even in the face of people who want to pretend it doesn't exist. And I guess, we've all kind of seen what's going on with DeSantis in Florida, a more continuing of trying to pretend that these things didn't happen. And no matter how much you pretend, you can't erase what happened. So it's kind of disappointing to see major political figures climbing onto the bandwagon of let's invent an American history that isn't real. Sad commentary. It was serendipitous to begin Black History Month by attending the first State of the State by Maryland's first Black governor, Wes Moore. And I thought the governor's address offered, pretty, strong perspectives and priorities that have been missing from the previous administration. As a former elementary school teacher, which certainly has affected how I look at these things, I really appreciated how Moore spoke specifically about the challenges of childhood poverty and how it impacts our schools and communities. This is a critical subject that we don't talk about enough, and I believe Governor Moore can help elevate this conversation in Annapolis and in the state, frankly. We have to take a hard look at the effects of child poverty on learning. Children who are hungry, neglected, lack proper parental supervision, or are bombarded with anxiety end up taking these problems, stresses, and traumas into the classroom. There's no way they can't. You are asking little children to deal with adult problems, and they are not equipped to deal with adult problems. But what they do see is the stress that these problems have and create for their parents. And stress, I think, as all of us will acknowledge, is not a healthy thing to have, particularly in family relationships when you're raising children. The more the children are exposed to it, the more it negatively impacts on them. Governor Moore adequately and concisely made this link in his remarks and the cost it has on all of us and our students and schools. I look forward to supporting his efforts to eradicate childhood poverty in this state. I also appreciated his focus on the need for investment in Maryland's most valuable asset, which is its people. I thought the way Governor Moore connected the dots between investing in our children and becoming the state in the nation, the best state in the nation for public education, and his initiatives to provide regional high school graduates with opportunities for community service as a means of future economic development for the state echoes the kind of discussions we've actually been having here in Montgomery County. There is absolutely a link between educational incomes and economic success. And that does not mean you have to go to college. It just means you have to be prepared for whatever work you're going to be doing in the future. I've stated on many occasions that if we're going to compete economically in our region, especially with Virginia, let alone other jurisdictions, we have to utilize our education assets to improve economic development goals. This is a priority that Amazon cited specifically when they chose Northern Virginia over Maryland for their HQ2 project. Governor Moore clearly understands this approach, and it's refreshing that we now have a governor who gets it. This is why our efforts to create a new University of Maryland 3 Institute for Health Computing in the North Metro Bethesda Station area and expanding Montgomery College into the new East County Education Center facility in White Oak later this year are a model for the rest of the state on how we can expand education opportunities and strengthen our business community and improve the quality of life. It's a win for every aspect of economic development and social development that anybody would want to look at. We look forward to working with Moore and Lieutenant Governor Miller and their new team. And I feel that Maryland's best days are to come, and Montgomery counties can continue to be at the epicenter of so much of the state's success. Protecting our communities also includes ensuring that our faith and nonprofit communities are safe. Over the last year, our counties experienced too many acts of hate, intimidation, and vandalism. On Monday, we announced the recipients of our $800,000 nonprofit security grant program. We are the only local jurisdiction to provide funding for operating support to community organizations that are facing acts of hatred. Through the application, we processed 55% of the 91 groups that were awarded money already had some prior history of dealing with threats and bias incidents. Many of the groups receiving grant money represent churches that have been vandalized for supporting social causes or because they represent recently targeted communities like Jewish, Asian American, and LGBTQ communities. Money these organizations collect should be spent on helping their communities, not on having to defend themselves. And this is, one of the sad things is, money is always going to be a scarce commodity. We have to make choices with how we spend money. And it is important that we protect institutions that are literally under attack in some cases. But the fact is, it would be nice if the attacks would cease and we could come to some kind of accommodation in our community for everybody to be able to live here in peace. So those resources could go to fund other things, which we really need. So, we know the money available through this program can be spent on security measures and crime deterrence, like video surveillance systems. And last year, when Scotland AME was vandalized, the suspects were actually caught on a security camera the church had purchased with this grant money. Other nonprofit groups said they intend to use the money to protect vulnerable areas like daycares or senior centers. And we're still calculating 2022 numbers, but 2021 saw more than a 20% jump in hate and bias crimes. And so if you see something, say something, please. Call the police. Our number for this is 240-773-8477. When any community, faith, ethnic group, minority group is intimidated or faces hate in this county, all of us are being attacked. And we will continue to respond to these acts of hate with unity, love, and compassion for those who've been victimized. As far as our COVID update this week, we've seen a decline in COVID hospitalizations, which means Montgomery County community level status is once again back in the low category. More COVID patients are being discharged from hospital stays and fewer entering the hospital. This is welcome news after several weeks when it seemed emergency rooms and EMS responders were being pushed to the brink of a crisis. We've learned from the CDC hospital data that the unvaccinated are far and away the biggest contributor to needing a hospital bed. But there was also a significant difference between people who got the bivalent booster after September of last year and those who didn't. Without the added protection, most adults were 3 times as likely to need a hospital bed compared to those who were considered fully vaccinated. But without the latest booster. Obviously, we continue to recommend the booster shot for everyone in your family. And January and December also continue to be the deadliest months for COVID. While our numbers are far below what we saw last year, there are still too many people needlessly dying when vaccines and treatments are widely available at pharmacies and at doctors' offices pretty much everywhere. This week, President Biden announced that in May, the federal government will end its declaration of a national emergency for COVID. It means funding will dry up for vaccines, testing, and other public safety measures that the feds have now for years been reimbursing states and county governments for in the name of public health. Additionally, the end of the emergency declaration is also going to impact Title 42, student loan forgiveness, as well as Medicaid and Medicare benefits when it comes to COVID tests, vaccines, and treatments. Montgomery County plans to continue offering free test kits and scheduling vaccine appointments through the end of the fiscal year, which is June 30th. And we will continue to be the only local government in the DMV still providing these regular updates. And as our effort is to remain vigilant and to help keep people aware of where COVID is. Obviously, a federal declaration is not going to make COVID go away. And we've already seen COVID morph itself many different times. So we'll continue to give you updates. Hopefully the updates will be brief and non-alarming. But should we have reason to, raise alarm bells for people and make people aware that they're in a more precarious situation than we are now, we will continue to use this vehicle to do that. But hopefully our discussions about COVID will reflect its reduced presence in the community, at least for now. So I'm going to turn over this portion of the media briefing to Sean O'Donnell for his report.
Thank you, Mr. County Executive. So just to expand upon what our county executives already shared with you all, we are seeing decreases in the hospitalizations of patients with COVID. 21 fewer patients at our primary acute care hospitals and 11 fewer patients at the alternate care site. So this is very encouraging news as we move out of January. Our emergency department visits overall. This is for any type of visit. You can see that those have come down over the last week as well. Again, this is very encouraging. We appreciate our partners at the Maryland Institute for Emergency Medical Services sharing this information with us, helping us track this. It does mean that we're having better turnaround time with our EMS vehicles as well. And you can see some of that, the reduced patients. We're starting to see emergency department. I'm sorry, the title here is needs to be updated, but we're seeing fewer visits with fever and flu-like symptoms with our older populations. Those have started to come down. We've been reporting these are very elevated the last few weeks. So those have started to come down as we've seen them come down with our younger populations. Really not much has changed here with looking at our variants. The XBB variant, it continues to make up a majority of our cases. And one thing we want to share that's new, I know we've shared this data before, the Montgomery County hospitalization rates by vaccination status. And unfortunately, we've not collected within our county the specific difference between types of vaccinations, but we have seen elevated rates of our unvaccinated. The CDC has begun releasing that data. This is a nationwide survey of more than 300 hospitals, and they began looking at the data in October, so giving about a month from when the bivalent booster was first available. And you can see on the far right of this, it's showing the larger numbers, the unvaccinated, completely unvaccinated population and the risk level. The second line below that are individuals who've had any range of vaccinations, but not including the bivalent booster. And that lowest line are those individuals who received a bivalent booster. So you can see there's even a significant protection by getting the bivalent booster over just having previous shots. This is for a 65 plus population. When you go to the link at the bottom there, you can see it for other age groups. Just to share, the 18 to 49 age group here is showing similar results. And across all of these, the benefit is roughly 3 times less likely to be hospitalized if you have that bivalent booster versus any number of other COVID shots. And that's just within this most recent time period, October to November. Obviously, they're still collecting information from these hospitals, and we'll keep sharing this because it does provide some evidence of how that bivalent booster is helping to protect individuals. The reason we bring up the 18 to 49, and you can see here that effect is seen across different ages, is because we're still seeing a big disparity in who's coming out to get that bivalent booster. When you look down at that 18 to 49 age group, it's still only about 1 in 4 of our residents in our county have gotten the bivalent booster. So again, we're sharing this information to help inform people's decisions about whether this is an important thing or not. We know hospitalizations have come down, but again, if you can reduce your risk of that, please go out and get the booster. As our county executive pointed out, the December and January continues to be our deadliest months. We had, unfortunately, over 50 deaths in January from COVID. Moving on to influenza, continuing to see nationwide decreases in influenza reports. You can see the hospitalizations, even within Maryland, have come down drastically. That's the red chart. And although we had a much more significant peak than some of the previous years, we're moving out of it a little. We moved into it sooner, and we're moving out of it sooner than we have in previous years. No new deaths reported across the state for influenza. So those were the updates we have today from the public health report. I'd like to see if Dr. Davis or Dr. Bridgers have anything additional to add on the public health side.
Thank you, Mr. O'Donnell. Just really briefly, we are cautiously optimistic with where we are seeing COVID go now that we've moved into the low levels of community spread. With that being said, it's still important for folks to get the booster, especially those who are high risk. So those who are 65 or older, those with chronic medical conditions, really anybody could benefit from COVID, but the ones who are most at risk of having complications, there's still benefit, as we saw from some of those charts, from having that booster, even as COVID rates continue to go down. And as the community transmission levels go down, we do start to look at things like long COVID and mental health aspects of that, and how we start to restore some of the mental health capacity in the system. And then we also want to reassure folks that as we see COVID levels decrease, we are still monitoring for COVID to be ahead of things, if a future wave should occur. And so we continue our wastewater surveillance, and that team is looking at COVID in different areas throughout the county, and as well as increasing our ability to look for things like RSV and influenza in the wastewater. So COVID is improving, our levels are decreasing. We still encourage folks to look at the booster, and we start to shift our focus in public health to really look at what are those long-term effects, and also looking at how do we continue up surveillance so that we aren't missing the next wave, or so that we're ahead of it. And I will turn to Dr. Bridgers for any additional comments.
Thank you, Dr. Davis. Just one point to add, as our county executive indicated, that while the president's intent to stop the public health emergency funds and resources for COVID, we continue to assess our impact and the impact of our operations. I know, Dr. Davis, you, Mr. O'Donnell, and I are having those conversations not only with our hospital partners, but with our internal operations, is looking at the funding that we have beyond the May the 11th deadline, or the deadline in May, I should say. So at the direction of our county executive, to continue those testing and vaccination efforts, those rapid tests that we provide well beyond that. So we're doing a deeper dive, and we will continue to have our conversations on how we can maximize and sustain our ability, even though the feds may stop. Dr. Stoddard?
I've got no opening comments for today.
Thank you. Thank you for those opening remarks. Members of the media, we're going to open it up, and I see Steve Bonnell has some questions for the officials this morning. Steve Bonnell, Bethesda Beach. Good morning, Steve.
Morning. I just have to note something. We rebranded today, so our outlet's now called MoCo 360. Just pretty much reflects that we cover stuff outside Bethesda, obviously. But enough about me and our company. The question I have is kind of on the ending kind of the public health emergency at the White House announced, and just kind of getting more into that. How, and any health official can answer this, how is the department and county kind of preparing for that? And I guess just what's the scope of the amount of funding that's being used for vaccines, and kind of other things that you guys are all receiving? And I know it's kind of long-winded, but that's kind of what I'm looking to know more about.
Sure. Thanks, Steve, for that question. So I'm actually going to ask Mr. O'Donnell to provide a comprehensive response. We received funding from the Maryland Department of Health, which supports our operations. We've have county level funding, ARPA funding, FEMA funding that Dr. Stoddard has been instrumental in managing and looking at not only the procurement of rapid test kits, but also masks and other PPE. So we're taking all of those things in consideration, but more importantly, the impact that it had or will have on our Minority Health Initiative partners, who have been also instrumental in supporting our public health initiatives across the county, and increasing not only access, but also an equitable distribution of that. So Mr. O'Donnell can go into the funding that we have, some of the funding that we received through a grant from the Maryland Department of Health. We have as carryover funds to sustain us, and we're looking at other ways, but more importantly, how we can continue our efforts. Also, the other piece to consider is the impact on hospitals and what it will have in staffing, and how our hospital partners have secured staffing, either through visiting nurses or support staffing, to respond to either acute care or chronic care or those individuals in intensive care units. And so that's part of all of our strategic thinking and framework. And we have those conversations. We began those conversations early on just to see not only how it would impact our fall operations this year, but also next fall, because we can suspect or anticipate and plan for perhaps another wave of respiratory illnesses. We don't know what those respiratory illnesses are. Dr. Davis is assessing what that may look like, whether or not it may be another wave of RSV, or whether or not it will be a new strain of influenza. And so Mr. O'Donnell is handling that, and Dr. Davis is looking at the clinical implications of that. So I'll stop there, and Dr. Davis or Mr. O'Donnell can add to that, but that's kind of where we are operationally.
Yeah, I can speak to, we do have a number of CDC grants that we've been awarded through the Maryland Department of Health. We've been using those funds for our vaccination efforts, for our disease control and outbreak control efforts with our congregate settings, as well as covering some of our epidemiology investigations. And by using those grants, we help to limit the local costs. So we have, and those grants go through June. So we won't be affected in our planned efforts for vaccinations and our planned efforts to, again, keep supporting the disease control aspect of this response. Those are funded through the end of this fiscal year. We had a meeting this morning with our budget team and with the Office of Management and Budget to better understand what those costs may be after this fiscal year, what they may be to the county. And we're working again with our leadership within HHS to figure out how we approach COVID after the emergency portion of this goes away. We've said in the past, just because a disease is deemed endemic doesn't mean it's not important to try to limit the transmissions. We do this very actively with TB, with HIV, and we'll certainly do this with COVID. And again, the big push that what we've been saying for months now is the most important people to protect, even as transmissions occur, are those that would have serious illness. So testing is something that our residents utilize to help understand if they have COVID and hopefully limit their contact with those at higher risk if they have a positive result until their symptoms subside. So we have been working with the state to bring in rapid tests through the state. Locally, we've purchased rapid tests as well to make up that difference. And so we still plan to do that. But again, we're working with our budget team to try to identify how much of these costs the county may need to pick up when some of those funding streams might not be available.
And sorry to cut in, but those CDC grants you mentioned, do you know roughly how much those are, and if they frankly are enough to backfill what you're anticipating losing, if that makes sense? You kind of already answered that, but can you just get in more into that?
Right. So we had on one of our CDC grants, we had about $3 million in carryover that we've been using to fund our vaccination efforts throughout this year. One of the things, though, that we've also noticed this year is we've now brought COVID vaccinations to every age group that's eligible. We've also seen a shift in the vaccine production where we've only had one new vaccine become available back in September. And it's beginning to sound like, I mean, there's certainly been discussions already, although a decision hasn't been made, but there's been discussions at the federal level about this potentially moving to an annual booster, the way flu shots have been administered. And so that, if that indeed is what happens, it would likely mean the public health push to get people vaccinated will be focused around the availability of that new booster. And so it'll be more of an annual effort and resource than a 365-day effort. We've already changed a little bit of our footprint this past week from offering these 7 days a week across the county to now down to 5 days a week. And part of that is a reduction in demand for testing and for vaccines. So certainly these costs have come down, and this is what we've been discussing with our budget team.
And last one, I'll circle back, if time allows. The Medicaid piece of this, that is, can you just get more into that in terms of how many people that might impact locally, and what the county is doing to kind of prepare on that aspect of it, I guess?
I don't know that we have the numbers for the county of individuals that would be moved off of Medicaid. The emergency protective measure was if somebody had qualified at one time and no longer qualified for Medicaid, they could not be pushed off of that during this emergency declaration. And so I don't currently have the information. That may be something that our state partners may be able to break down for us by jurisdiction. We can certainly ask that of them. But often the reason they don't qualify for Medicaid now is because they would qualify for insurance through another source. So I hope that would be the majority of individuals. It may not be everyone though. So it's a good question, but I think the answer might be a little bit more nuanced.
Okay. I know, it looks like Tom Sherwood has a question here, so I'll defer to that and I'll circle back.
Thank you. I couldn't hear you very well, Steve. Are you done?
I'm done for now. It looks like Tom Sherwood has a
Okay.
question.
All right. Thank you. Steve Bonnell, Mocha 360. Up next, Tom Sherwood, WAMU Politics Hour. Tom, you posted the question on the chat, but do you want to ask it?
No, I think it's a pretty simple question. I'll just wait for the answer.
All right. So the question is, what is the status of State Highway Administration bike lanes on Old Georgetown Road?
I am happy to answer because I just got an update from Wade Holland, who's our Vision Zero coordinator. He said that the SHA provided, last update the SHA provided to the partners meeting was that they are in the process of developing a preliminary report that will do the travel modeling as well as the potential cut-through issues that they're seeing with others trying to avoid the increased traffic that you're seeing on Old Georgetown Road. They didn't give a time frame, but the sense is that would be before that would be this spring. There was supposed to be a summer study that was discussed, but they're actually going to advance that work to try and have it done during the spring. So we weren't given a firm timeline, but we were led to believe that over the next couple of months, we'd see a preliminary report that aims to look at the impacts from the bike lane modifications from the state.
Thank you.
Thank you, Tom. I do not see any more questions on the chat from members of the media. Do you have any more questions? Anybody else?
I just have one more, Lorna.
Okay, go ahead, Steve.
I know you all have been stockpiling, again, any of the health officials can answer this, stockpiling, test kits, masks. I mean, I just want to get, if you have the numbers handy, or just even you roughly know how much of inventory you have when it comes to the rapid test kits and masks that you've been handing out of libraries and whatnot, just what the status of that is, I guess.
If you give me 1 minute, I can pull up our current number.
I'll just add while Mr. Donald's pulling that up, the challenge that we're going to face is much of the rapid test kits that we purchased are reimbursable, and we have been submitting reimbursement as we use them. They will not reimburse us for kits that we have not deployed, as in given to the public through various venues as of that timeline of the expiration of the disaster. So even though we have kits stockpiled, we will be on the hook for the cost of those kits, assuming we have stockpiled them beyond the end of the emergency declaration period. So even having them in hand doesn't mean the county won't end up paying for them if we grossly overestimate the number of kits that we'll need between now and May.
And Steve, I anticipate that we should be receiving our monthly shipment from the state sometime this week or early next week. And that would put us at about 150,000 rapid test kits in our warehouse, and another, I'd say, 20 to 30,000 out at the libraries already. So you know, we certainly have, and the demand has gone down a bit. That was very high in December, as you can imagine, and in January, but it's starting to go down again. So we do have, we have that on hand. And again, as Dr. Stoddard mentioned, we'll likely do another purchase here with the anticipation that we would get some FEMA reimbursement for these, as long as we're distributing them before the end of that emergency declaration.
And the masks, unless you don't have it handy, the number of masks.
I don't have
I
that.
know it's more than 3 million at this point still remaining, but I don't know how many more than that.
And then Dr. Stoddard, the monetary impact of, you know, if you have these kits sitting around, you know, after May, do you know roughly what that, I mean, it might be tough to say, but what, now obviously you're trying to avoid that, but what that might look like, I guess.
Well, I mean, the cost for those kits, depending, I mean, it varies a little bit, but we use the rough estimate of a you know, one of the boxes, which is 2 tests, usually about $5 a kit. And so that tells you essentially what you would be talking about. Obviously distribution has varied, you know, obviously certain weeks during the week immediately leading up to the holidays, for example, was a very significant week for people getting those test kits. Obviously with us being low transmission, means fewer people will be seeking them. But, you know, many weeks we're giving out a few thousand, some weeks we're giving out, you know, tens of thousands. It varies. And so obviously, as we go into, we talked about, we'll have the kits through the end of the fiscal year, which is obviously the end of June. The summers tend to be very light in terms of the number of people coming to the libraries to get kits. But I would guess that we would see a greater challenge next fall, and we'll have to really work on what our, you know, next fall strategy will be in light of the fact that the kit will likely not be an option from the federal government, at least.
Thank you, everyone.
Thank you, Steve. Members of the media, any more questions? No more questions for the officials today? Well, thank you for joining us. Have a great afternoon. Stay safe, and we'll see you next time.
Thank you.
Bye-bye. Thank you.